All right, hello and welcome. My name is Amy Royer and I'm the project coordinator of the Rural Health Initiative. The mission of RHI is to engage partners to share ideas and expertise and support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us today for our webinar, Healthy by Design. I'll introduce the presenters now. We have Heather Fink. She serves as the Community Health Improvement Manager for Healthy by Design, a multi-sector community coalition focused on promoting and improving the health of those in Yellowstone County. Heather's position is sponsored by Yellowstone City County Health Department in Riverstone Health Billings Clinic and St. Vincent Healthcare located in Billings. Ms. Fink has spent her career working on social and health service organizations in varied capacities. She holds undergraduate degrees in public relations and religion from Wartburg College and a master's in integrated corporate communication from the School of Journalism at Drake University. Iowa-born, raised, and educated, she has resided in Montana for 14 years now. We have Shawn Hinz. She serves as the Vice President of Public Health at Riverstone Health, a city-county health department for Billings in Yellowstone County. She holds undergraduate degrees in psychology, sociology, and a master's in public health from the University of Montana. With a background in social work, Ms. Hinz has extensive experience in child protective services, home visiting, in addition to family and public health. She has served in leadership roles for her entire career and played a key role in Riverstone Health being designated as the 44th health department in the nation to receive public health accreditation. Jeanne Hammond Manske is the Community Benefit Coordinator for Billings Clinic, the largest healthcare organization in Montana, based in Billings. Ms. Manske has coordinated community benefit reporting and communications for Billings Clinic for more than 15 years, as well as marketing and strategic planning for integrated multi-specialty clinic and hospital services. She holds an undergraduate degree in liberal arts and public relations and a master's degree in technical communication. She also likes to hang out with her family and dogs in the Montana outdoors. And April EnnisKeippel is the Mission and Community Benefit Programs Manager for St. Vincent Healthcare in Billings. She serves as the Project Director for the Office of Women's Health Coalition for the Healthier Community Grant-funded project. A fourth-generation Montana, she received her MA in Organizational Communications from the University of Montana and previously spent 10 years working in the marketing field. Each of these four individuals are 2015 Fellows of the Leadership Academy for Public Health and serve as the backbone committee for the Community Health Improvement Coalition, Healthy by Design. So I'll go over a few technical details before we get started. All lines are set to mute. Presenters, if you want to unmute yourself at any time, you can do so by selecting the microphone icon. At the end of the presentation, we will have a question and answer session, and at this time, I will unmute all lines. So if you wish to remain mute during the Q&A, you can do so by selecting the microphone icon, or you can press mute on your phone. You can also submit questions in the chat box on the right side of your screen during the presentation, and they will be addressed during the question and answer session. If you type into the chat box, please make sure that you are selecting all participants before sending your comments. Otherwise, the comments will just be seen by me. Additionally, when the webinar is over, you will have an opportunity to provide valuable feedback through a brief survey. It's about 7 questions and should only take about a minute, and it will automatically pop up on your screen. So thank you again for joining us today. I will now roll the ball over to Heather, and she can begin the presentation.
Good morning. This is Heather Fink. I want to make sure that April has a chance to share her screen, so I'm going to wait just one moment. We have folks in different locations. All right, so I'm going to begin. As mentioned, my name is Heather Fink, and I'm the Community Health Improvement Manager on behalf of Healthy by Design. Our focus is to make the healthy choice the easy choice across Yellowstone County, and my position is unique, as is the structure of Healthy by Design, in that it is a position that is sponsored by 3 entities in Billings, Riverstone Health, St. Vincent Healthcare, and Billings Clinic, and we work together in various capacities. but in this situation, we help to sponsor the work that that is Healthy by Design, and we involve all kinds of community partners in that work. I'm going to go ahead and ask for next slide. Thank you, April. So the three partners I mentioned consider themselves the alliance in relationship to the CEOs working together, and that partnership has been in existence actually since 1994 and really in more of a formal way since 2001. And some of the early work began around the community health needs assessment. They began working on collaborative community health needs assessment and have now completed, just finished our fourth cycle of developing that needs assessment report. And I would just kind of highlight that that's a pretty unique example in kind of a national setting. There's been more and more trend to have our community health needs assessments that are required by hospitals and public health departments that are accredited to look at partnership among entities to actually complete those assessments. But in our county and in Billings specifically, there's been this collaboration happening for many years, and it's provided opportunity not only to work on a needs assessment, but also respond to data. And some of the initiatives you see on this screen are work that has been done collaboratively among these partners as the Alliance. I'm going to ask for next screen. Thank you. There's a few dynamics here, so just getting those up here. Apologize. Thank you. So as I mentioned, the community health needs assessment has been going on for several years in our community collaboratively. I wanted to just share with you the components of our needs assessment. We work with a third party, PRC, professional research consultants, to execute our needs assessments, and most recently have had 400 adults participate in a phone survey using both cell and landlines. In addition, there's components related to secondary data that are provided on that needs assessment. And then we added an kind of unique component this round with key informants. And those were leaders in the community within various sectors, as you can see on this slide, that were asked to give impressions and perceptions of the health of Yellowstone County, giving us a chance to hear from other professionals about their perspectives related to what the key issues are. Next slide. So we've talked about the data that we've collected using PRC, and that's kind of an initial step on the process that we take locally to get from data to information to response and action and evaluation. And so this timeline sets out some of those components. You'll see the letters ACHI in red along this timeline, and ACHI is the Association for Community Health Improvement. We've used a framework that they've provided to really drive the steps of our community health needs assessment and community health improvement plan process. So we went from survey design and conducting the survey with our partner to looking at results and being very intentional about communicating results. And now we're in actually a phase of looking at prioritization to now publishing and releasing that information to the public. Our next steps will then be to work through a community health improvement plan process, and we will develop a community plan that we will look at through the lens of our Healthy by Design multi-sector coalition. Next slide. So the approach that we will take when we look at this community health improvement plan is to consider things from really an angle of how do we implement things that can impact our community's health long term. So we talk about that in the language of policies, systems, and environmental change. And if you look at this pyramid, the health impact pyramid provided by the Centers for Disease Control, you can see that bottom component of the triangle talks about socioeconomic factors, and alongside that you see things like poverty and education and housing and inequality. And we would hope that our interventions through that kind of policy and systems and environmental level fall along those kind of bottom components of changing context and looking at socioeconomic factors through a policy, systems, and environmental approach where we can find the biggest impact and kind of the longest lasting impact as well. So an example that we have here on this slide is if we're thinking about a policy approach, rather than maybe a clinical intervention that's a point in time with an individual, we would look at a community approach that's lasting through a policy. So in this case, a tobacco-free campus is a policy that would be put in place that would impact both that employer and also public users in that realm and on that campus. Next slide, please. So related to kind of where we're building on, we've touched on kind of our driver, which is the data, our community health needs assessment. And then we've also talked about our approach looking at the CDC pyramid and policy systems and environmental change that our Healthy by Design Coalition focuses on. So the next kind of component that I wanted to introduce is the framework that we've been working to adopt. And it was mentioned in our introductions that this team of individuals representing 3 different entities and then myself representing the coalition had the opportunity to go through the National Leadership Academy for the Public Health. And we are now adopting an approach of collective impact through that kind of year of learning that we had the opportunity to participate in. And here I wanted to frame up those 5 conditions that we use as well as introduce the preconditions to that collective impact approach. So you can see here that we initially look at how we can form a common agenda around an issue and then also shared measurements, additionally mutually reinforcing activities, continuous communication, and then backbone support. And those preconditions that really kind of feed into those 5 conditions are thinking about, do we have influential champions or champion in place, and do we have the financial resources and general resources to make that work happen? Additionally, do we have a sense of urgency and really kind of cause to action for change? So I would ask us to kind of consider that framework as we move through kind of an example of the work in just a few moments. I wanted to first give this kind of precursor, and it's a difficult slide to read, I apologize, but I wanted to share with you kind of one piece of kind of the measurement component that we add to this building up this platform. So we've talked about the data, the approach, the framework, and then this is kind of part of the plan. An example through one of our priorities, the Healthy Weight priority that you'll hear more about, we use the Community Health Needs Assessment data to drive our goal and our objectives, and then more detail to follow related to strategies and resources and those components that we would flesh out related to collective impact. So next slide, please, April. So what we're going to kind of look at now is our response to all of this kind of build up, where we would determine how we address the issue, what we look like when we start to activate things, and what components of collective impact can we infuse into the work. Always trying to address the preconditions and the conditions, but knowing that we are not living in a perfect world, but we try to strive toward that. So knowing kind of all of these steps that we've taken to prepare ourselves and all of the tools we have in place, I'd like to turn it over to April to give her the floor and give us an example of where we've been and what we've done.
Thank you. So in focusing in, you saw earlier some information about our Healthy Weight priority, and I'm going to focus in just on one of the aspects of that, which is physical activity. And you can see on this slide, this was from our 2010 Community Health Needs Assessment, that almost 30% of people in our county in an entire month said they had 0 leisure time physical activity, which was really a concern as we're working towards obesity prevention. And you can also see a disparity pretty clear between men and women, where women are much more likely to report no leisure time physical activity. And so collectively, we were working towards a lot of different tactics, and we had work groups that were working towards improving those physical activity rates through a variety of measures. And so here you're seeing one of those. It's workplace policies. And you can see an example of checklists that we had developed that would provide work sites with opportunities for how could you increase physical activity in a workplace. And we gently framed it in terms of guidelines. So, in some cases the word policy might not be seen in the most positive light. So we talked about physical activity guidelines. We had a project with Big Sky Economic Development that also provided technical assistance to some small businesses to help them try to improve the environment in the workplace to really be conducive to healthy activity. So that was one tactic we worked on, and it was small things, even encouraging standing up. So if you want to stand up while you're listening to the webinar, we would encourage that. Activity breaks throughout the day. We also focused on a much broader scale on community policies. So trying to make sure that the healthy choice would really be the easy choice and making an environment conducive to having greater increases in physical activity. And so in August 2011, the Billings City Council unanimously adopted a Complete Streets resolution. And there was a lot of different folks behind the scene helping to advocate for that. We actually had one of our city council members remark that it was the most feedback they had gotten from constituents since the medical marijuana issue. So we knew we had a lot of support. But city council members change, and so we had a new set of city council members, and you can't just create the policy and just let it sit on a shelf. And so we really had to go back to the advocacy work and framed it in terms of equity. This was really a policy about equity for our community. And the revised resolution was passed in May of this past year by the City Council. So with that, we're creating an environment that's safe for people to engage in activity. We're also promoting activity with separate groups. So for children in our community, we had a couple projects happening that focused specifically on youth and schools. We had a grant through EnnisKeippel that helped us to create a 5210 message. It was focused on childhood obesity prevention. You can see one of the little gals there with that 5210 on her backpack. We had Safe Routes to School, who was also very vocal advocates for the Complete Streets policy. We had groups like Billings Action for Healthy Kids and the School Health Advisory Council, who were really helping to promote in the schools physical activity as a way of improving test scores. And you can see one of the images of brain scans from active living research showing how much better students do after they've had a 20-minute walk on test scores. So really creating an environment conducive to physical activity. In addition, the project that was mentioned earlier in the introduction for myself was a gender-focused intervention with a grant from the Office on Women's Health. And we had 12-week activity classes that focused on accumulated lifestyle activity and acknowledged barriers related to women's caregiving roles, their responsibilities that made it more challenging maybe, or at least the perception that it was more challenging to engage in physical activity. We had a lot of social support in those. They weren't classes where people had to sweat in front of others. It was sitting around the table talking about becoming more active, which actually made people more active. It's evidence-based intervention. And so we had that going on as well. With that, we also had a social marketing campaign, which was called It All Adds Up, and it also focused on that accumulated lifestyle activity. And so looking at ways that incorporated those gender roles and responsibilities in a way that would be conducive to activity. And you can see along the bottom, we also had the 5210 message included in with that marketing message. So it all was adding up together. And I'm going to turn over to Jeanne, who's going to walk you through how this example truly is an example of collective impact.
Okay, hello, this is Jeanne Manske. Good morning. So the collective impact was based on those prerequisites that Heather had talked about, and we had, it didn't happen overnight, but we were able to pull together some funding, some grants, some champions, including physicians, and we're able to get this work done. The slide that we're looking at right now talks about how we're able to measure the results using the Community Health Needs Assessment, and you can see that we have been successful at slowly increasing leisure time. This graph shows a decrease in the no leisure time physical activity. So here we talk about that successful examples of collective impact are addressing social issues that require many different players to change their behavior in order to solve a complex problem. So we have to really work together with other folks, like April actually mentioned, schools and city council and a variety of places. This concept has been around since 2011. Stanford Social Innovation Review article started that. John Kania, the managing director at FSG, and Mark Kramer from the Kennedy School. Collective impact was then chosen as the philanthropy buzzword for 2011. It has been recognized by the White House Council for Community Solutions as an important framework for progress on social issues. And we certainly have been seeing it more and more since we learned about it a year ago. I see a note about whether we hired a consultant for this, and I just want to mention that that we had the opportunity, our group of 4, to be part of the National Leadership Academy for the public's health, not just public health, but public's. And we did have a coach who helped us train us in this work. We had monthly calls, and we had meetings and access to webinars. So that was all provided through a grant process, through a competitive process. So we were lucky that we did have consultants through that program. So this concept of collective impact hinges on the idea that for organizations to create a lasting solution to social problems, they need to coordinate their efforts and work together and have a clearly defined goal. Sometimes, as we know, defining the problem is the hardest part, or defining the goal of how can each organization make an effort towards a larger goal. So this approach is placed in contrast to isolated impact, where organizations primarily work alone to solve social problems. We certainly still work alone on some of these problems, but the process of getting together every month and talking about collective impact helps us think about how we can work together better towards the same goals. So collective impact moves away from this, arguing that organizations should form cross-sector coalitions that can make meaningful and sustainable progress on social issues. One example of that is Heather pulled together a group of organizations who are all working on healthy weight for children, safe routes to school, better nutrition in schools, and just had everyone talk together about what their goals were and how those groups could work best together, separately and together. Sometimes the process of just meeting each other helps clarify those goals as well. So on this slide, we're talking about the phases of collective impact, and initiating action, then organizing for impact, sustaining the action and the impact. And so for number 1, this requires an understanding of the landscape of key players, the existing work, baseline data, and initial structure. In strategic planning, we might say we're doing a gap analysis. You might do a social networking map, talk about who's all working on the same topic, and then create a structure of how to work together. Number 2 requires the stakeholders to work together on shared goals and measures. So once again, the process of creating shared goals and measures is something that helps you learn a lot about what you're all doing and what your goals are. And then you create a backbone. We use the phrase backbone in our structure to talk about how we can hold everything together through a backbone team that meets every month. And this begins the process of alignment. The backbone has to all share some similar goals so that you can work together. Number 3 requires the stakeholders to pursue prioritized areas for action in a coordinated way. So, and systemically collect data. We already have this community health needs assessment process every 3 years. That's how we do that. You may have to collect other data if you do have grant funding or other requirements. And then you put in place the sustainable processes that will enable active learning and course correcting as you track progress toward your common goals. So constantly looking back at your goals and objectives and then determining if you need to learn more together and if you need to change course. Certainly changes in politics, for example, or legislation might cause you to do that. Changes in leadership or changes in your community. Next slide. This has a really big capital letters important at the top, so we want to make sure that we just want to share things that we've learned. And it's once again going back to those prerequisites. But building from collaborative efforts that already exist, that's really helpful. We've often worked together over 20 years, actually, in our community to look at community health issues that we can't solve individually and that we know we need to partner on. So looking at current collaboration before moving forward with collective impact is great. Being realistic about the time it will take to work through stages. Collaboration, coordination among different organizations is not easy. It can be fun, but it's definitely slow. We often stop and take a little break and talk about culture and say things like, well, in our organization we have a formal culture and we have several levels of approval that we may need to go through, which may take a couple weeks. And so we sometimes have to stop and say, I'm not trying to put a roadblock. This is just the reality of my organizational culture, and we stop and take little breaks to have those discussions. And then recognize unexpected wins along the way. And that's kind of what we have to do all the time. Encourage each other, be happy about little things that happen, and like this says, unexpected, sometimes taking credit and sometimes saying, maybe this just happened because we had an awareness of it, but hey, let's celebrate. This is something that's going to help our cause. Phase 1 and 2, our experience can take 6 months to 2 years, just trying to get this collaboration going and have structure and work on goals. And then the phase 3, so going back to the previous slide, that was sustaining action and impact. That's the kind of thing that definitely takes years. So we may have a goal that by the next community health needs assessment, we hope to see a trend, but if you remember our previous slide with our trends about leisure time, physical activity, we were talking about 10 years. It took 10 years to have a statistically significant change in the trend there, where now it's definitely going downward, meaning people are actually spending more leisure time having some kind of physical activity. So we have to be patient. I can speak that that's really difficult for healthcare providers who like to fix things quickly, and the public health perspective is definitely more long-term. So it can help encourage you to realize how long these things can take. It's good to have milestones as well, and looking back and saying, hey, here's some great things we've done in the last 6 months. We've gotten together, we've talked about mutual goals, and that whole process has value. Next slide. So different levels of linked collaboration. We created this slide last year during our NLAF program, thinking about, well, if we all just climb up our ladder toward the same goal, that, we'll just all reach the top simultaneously, everything's going to be great. The reality is on the right, and that is, moving around, and it's circular, and there's this different shape to how we actually do we even know when we're at the top and met our goal, and is the goal constantly revolving? So trying to change our expectations on how we can work together to reach the goal is better than thinking it is going to be a straight process like a ladder. What we did is we established our oversight group. We had different CEO or executive level individuals from organizations who were engaged in the issue, created an agenda, established boundaries and framework, and then this oversight group meets regularly to discuss progress. And then, so that's kind of this, broad picture group at the top. Second, then we created working groups, and so those are formed around primary strategies. So that's a continuous process of planning and doing grounded in evidence-based feedback. What is and isn't working. Sometimes that evidence base comes from a regional or national research with other organizations and communities, and then sometimes it's just what are we doing, and is this working for us? And then develop plans for action focused on moving the needle toward the goals. Coming together on a regular basis to share data and stories about progress being made, and then communicating activities more broadly. So, it's okay to talk about what you're doing at your organization, but then how does that relate to the other groups that you're working with? And then the subgroups might take on a specific objective. So how can they communicate and coordinate with each other? The structure can change over time, and then what's really critical is finding strategies to link everything to the common agenda. So different levels of work being done with a different focus, but always reminding everyone of the shared collective impact agenda. So this chart, I think, can be really helpful in if you keep this to think about what we've described today. So the 3 phases going across the top, and knowing that that each phase might take 6 months to a year or longer. And then the components for success. So making sure you have each component at each phase before you try to move forward. It can be hard to say we're going to work on sustainability before you've actually figured out the data and the goals. So these are all the components of success, and these will help you identify progress along the way. Also, I'll just add, it's okay if you have a few boxes in phase 1 and phase 2 at the same time. This can be kind of messy work, but try to keep going back to make sure that you're working to accomplish phase 1 before you move forward too much. Next slide. And then the 4 network principles, be sure to focus on the mission, not the organization. And, that can be hard, but it's really just admitting that it's messy, and sometimes calling each other and saying, hey, you're thinking of your job at your organization. Let's think about our collective work for a minute. Shifting the mindset to the network and the leadership of the Collective Impact Network. This isn't the only approach. There's lots of other work out there. There's other names for this work, which could include networking, social impact networks, or aligned action. And looking again at the principles, just making sure that you trust each other, have discussion about trust, having humility, and trying not to think about branding it as your own, and the node, not the hub, that it's really a network of different nodes working together. Thank you. I'm going to hand this over to Shawn.
Thank you, Jeanne. This is Shawn Hinz, and I'm going to actually summarize some of our key learnings. This slide really does kind of symbolize what's happening with regard to herding cats. In collective impact, as we work through this, we really do understand that this is a difficult process. What's really important about this picture is it depicts that all of the cats are running in the same direction. So that really is our focus. We're letting go of our recognition. We're trying to produce better outcomes, and our bottom line is we really want to try to align the work that's happening in the community. So in collective impact, there's a quote that talks about saying that this is the journey, not the destination. We want to focus on all of the events that are happening at the same time, which really creates a difficult scenario at times, especially for outsiders to interpret if they haven't been a part of these key learnings. There has to be a continuous conversation in the community about the skills, about the mastery of these skills, and actually learning about collective impact. And so as we promote this work in our community, we're really looking at some key elements of orienting individuals as they come in from various sectors to look at this work, maintaining regular meetings and attendance at those meetings, and then sharing our learnings too. And that can be through webinars, readings, book reports, being sure that we distribute what we've learned so that everybody has the opportunity to have the information they need. Next slide. As we looked at our team formation, we're really looking at a steering committee, which is an overarching committee from our community that are decision makers. They're key investors in the strategies and in the priorities and the work that we're doing. Our backbone committee is really our leadership that's looking at how we implement the strategies and the work that's being done. And a key consideration with regard to the backbone committee is actually funding this backbone committee so that there's an investment in the work that's being done. Then when we look at our coalition, we're looking at multi-sector participants coming together to share the work that's being done on a priority. And this is actually more diverse when we get to the work group and the leadership in the work group or specific task groups. So you can kind of see the framework as it's rolling out. We're trying to engage individuals in this conversation at many levels, helping them see the collective vision of how we're all connected. This framework is really based on the community being the expert in driving health and the priorities that we're looking at. When we look at collective impact, health equity is really the foundation or the soul of collective impact. And there are lots of slides and information that's available to actually advance that topic of collective impact and help individuals understand why this is an important concept. Next slide, please. So what's really important that we've gained in kind of summarizing our work is that we have some intangibles. We have known each other for a long time, but we continue to build relationship. And in building that relationship, we're doing that both formally and informally. So we're sharing with each other. We're building trust, and we're reminding each other, and I think Jeanne alluded to this, that oftentimes we have to put on a different hat. It's not an organizational hat, but a community hat. And we have to be as transparent as possible to build this trust, understanding that at times we may have conflict, whether it's organizational conflict or personal conflict, but that we have the skills to be able to work through that and enough relationship and trust built to be able to talk about that. We have to identify our leadership in this initiative, and so in coming together and looking at collective impact in our community, we actually did some foundational, fundamental building in leadership. We identified what our leadership styles were. We talked with others about what they needed as we were forming our leadership styles. And we took the Myers-Briggs individually and then collectively as a group so that we could understand that we had various styles. What was really important in looking at this is that we were bringing in individuals in leadership that were visionaries, that could see the big picture, that were nurturers who could engage the community in this work, that were mobilizers that could create the sense of urgency to actually get the work started and sustain it. And then we had people, leaders, that were analysts, that they could actually look at the quality of the work that was being done. So again, in our culture of learning, we really focused on strengthening the relationships, sharing the information, emphasizing people and process, and then personal attributes and how that fed into the collective work that was being done. We also used the topic of appreciative inquiry, which was really affirmation and appreciation for all of the work that various individuals were providing in collective impact work, whether it was at our steering committee, backbone, or work group levels. Next slide, please. We've put up a couple of resources for you where there is a lot of information that has been captured on collective impact. In addition, there are collective impact forums that are advertised through these various resources a couple of times a year throughout the United States that are bringing together individuals that are learning about collective impact and that are also utilizing collective impact. And so there really is an opportunity to learn from each other in the forums. So I encourage you to go back, look at these resources, and then look at the forums that are being held. Next slide, please. So to summarize, it's really important at this point to have the community members working together to figure out how to work on each priority. New techniques and approaches actually engage the community in understanding the issues, the priorities, the system. Be as inclusive as possible. What we've learned in this model is that people that are in the community who have lived the experience have a lot to share about how to work towards success and sustainability in priorities with the strategies and the work that's being done. These members of the community who have actually lived this experience or have been more directly affected by whatever the topic is, if it's physical activity and nutrition or increasing activity, this approach really allows us to say to them what would make a difference. And if you can pay for lived experience like you would a consultant, it really brings the community together and members to contribute their work to this effort. This approach enables participation at all levels. And next slide. As we finalize, again, collective impact is really about the journey and the process. And so there are key outcomes and successes that can occur as long as you embrace what's happening. Remember, a basket has two handles for two people to carry. Thank you.
Heather, do you see the question on the chat part? Do you want to answer that?
Sure, this is Heather again, and it's my contact information that is on the last slide here. So if you do have any inquiries post the webinar, feel free to send them my way. So the question at the bottom that I see here is, can you give us an idea of who's on the steering committee versus the backbone committee? So, and I'm happy to follow up with structure slides. They just tend to get cumbersome, I think, in a webinar format sometimes. But we have, over the last year, kind of revisited related to collective impact our structure. And as I had alluded to earlier, we're also on the cusp of working through our latest needs assessment and improvement planning process. And so there will likely be some movement on that structure to adopt and adapt to that improvement plan as well. But as it stands right now, we have a backbone committee, and really what we see the functionality of that backbone committee to be for us currently is at that kind of operations level and holding folks accountable within kind of our sponsoring entities for that operations piece. Our steering committee then is really kind of our outward facing, keeping folks kind of aligned related to vision and governance and thinking more broadly about what does it take to engage maybe those sectors that perhaps health and social services are challenged to engage more typically, so looking at kind of some of the government entities and business sectors, for-profit, tourism, community development, thinking more along those lines. We've just tried to engage our steering committee membership to really reflect more of that kind of outward facing and challenge us to think more broadly about who we engage in a multi-sector coalition and what benefits that our work provide to the entire community, and in turn, why would multiple sectors across the community be interested in engaging in our efforts? I hope that helps.
And this is Jeanne. I would just add, if there, probably everyone on this call is from a smaller town than Billings. Specifically, we have someone from United Way, and if you have a group like United Way that helps to pull together social service agencies, that's really helpful. Also, we have a business owner who owns several businesses in the community. Chamber of Commerce is also a good place to look. And then we have someone who is part of the local media, who's a journalist and has a broad perspective of community issues. So those are some entities to consider. In your community, you might have one person at the newspaper and one person who's part of some kind of a United Way group, or just a leader of a social service agency, and then maybe a business owner who's interested in community health for other reasons like recruitment and retention of employees.
Heather, would you like me to go into the question and answer and unmute everyone?
Sure, I think we're at that point, definitely.
Okay. So just if you don't have a question, you'll just need to unmute your line yourself. Okay, everyone should be unmuted in just a moment. Sometimes it takes a couple seconds to register. They're unmuted. Yes, they are. So if anyone has a question, go ahead and ask any one of the presenters.
As we're kind of open to dialogue, I would just also mention that I think I kind of alluded to this, but we are definitely still students of the model, and I think that's important to just remember that it's kind of this evolution of understanding that we continue to try and kind of strive toward inclusion of collective impact and alignment through our work, but there's always areas of opportunity, and where we really see this is that we continue to learn lessons along the way and kind of have these aha moments of what makes the most sense in regard to what we can accomplish. But I think the frameworks have really helped us kind of begin the journey of the work and really kind of recognize, though complicated and messy, that it is truly an inclusive opportunity and allows for a more collective outcome.
Hi, this is Kathy. Can anyone hear me?
Yeah.
So I'm interested in the shared metrics part, and I can see how you've gotten some of your data and then probably from that data came up with some of your goals. But I'm wondering, in the shared metrics idea, how did you get partners to come on board with what maybe looks like a health metric, and maybe they're a business owner, or maybe they're the county planner or whatever?
This is Heather. I'll jump in first, and if anybody else wants to add, I think you've hit on a key pain point. I think that's a place where we're really trying to work with our steering committee on where there's shared opportunity and shared pain. Because you're right, if you're within a health sector, how do you translate a question and an action point to something that makes sense in a different sector? And that's where I really see the value of our steering committee. And so really I see that as our next kind of phase of integration in moving into this next improvement plan cycle, is how we can make sure that our metric matters to those outside of the health sector. And maybe if our metric doesn't matter, is there, can the question matter enough that perhaps there are dual metrics or multiple metrics, but they're still potentially improving on that ultimate goal. So we're kind of evaluating kind of both schools of thought related to that. What we've done previously is really held up our data from the needs assessment as kind of our ultimate data measurement and our data point. What we're now seeking is trying to find those intervention and kind of intermediary measurement points that will cut across those sectors. And so you're exactly right, Kathy, that it's a difficult message, but what we're really trying to do kind of with this iteration of our work is ask those that are in those sectors to help us frame that so that we can be most effective in bringing those individuals and those entities along.
And this is Shawn. The other opportunity that we're given is to keep the metric as simplistic as possible, and I think that's the coaching that we've received. So Heather, is sharing that we're going into that next phase again, and that we're really coaching on simplicity too, so that it's impactful but it's simplistic.
And this is April. I'll just add too that while maybe our metrics weren't necessarily as accessible to different groups, I think when you get down to the nuts and bolts of the intervention, we really made an effort to try to connect it to what would matter to particular groups. So for business folks, as we did the project I spoke about, a lot of that is we're potentially cutting costs for them, improving their productivity. For schools, it was looking at test scores, not necessarily looking at the measure that we were using, which was a health measure. And even for the Office on Women's Health grant, we were working with churches and other nonprofit groups to do the intervention. And I think for them, it's a slightly different message as well. So while the metric may not have been as accessible, I think the way we approached folks to join in with what we were doing and to try to encourage them to be a part of it was done in a way where it was addressing what was in it for them, not so much what was in it for us.
We have just a few more minutes if there are any more questions. All right, well, I will go ahead and share the link where you can find the recording of this presentation, and hopefully by tomorrow I can get it up there. And if that is all, we can wrap up a little early.
Thank you so much for the opportunity.
Yes, thank you.
Centers, it was a wonderful presentation. Thank you. Have a great day, everyone. You too.
Bye.